Good morning. It's Eve here, clinical nutritional therapist and associate naturopath. And this morning I'm going to talk to you about stool tests. So stool tests are where a sample of your bowel movement, also known as your poop, gets sent to a laboratory, and I get sent a whole heap of data and information about your digestive tract from the laboratories that I work with. Stool tests that you have done privately are much more comprehensive than the ones that you might have had done with your GP. The GP ones are very, very basic. They check for certain nasties and that's it. But with a private stool test, I can see basically the functioning of your body in almost like a 3D way. So things that I can check for, first of all, obviously, all the nasty bacterias that you might pick up that might give you horrible diarrhea and food poisoning, that sort of thing. So they are checked for. But in addition to that, I get a full profile of your intestinal microbiota, which is your microbiome. So I can see how many of the good bacteria you have, what's missing, if any of them are low. I can see the variety. I can also see any pathogenic bacteria, so ones that have been allowed to either increase in their numbers from what should be a small amount of numbers to a very large amount of numbers that might be causing you problems, or really horrible bacteria that you might have picked up along the way, things like C. difficile and that kind of thing. So apart from that, we can check for parasites, worms, molds, fungi and yeasts. Candida is a big one that shows up on tests. And all these things can be responsible for not only nasty digestive symptoms, but for feeling fatigued, being absolutely wiped out, skin problems, bloating, horrible hormonal issues. It all has an effect, everybody. What else can we check for? We can check for things like H. pylori, which is really nasty and can give people a lot of heartburn and reflux and pain in the upper digestive tract. I can see the pH of your stool, which is a reflection of the environment it has traversed through. So the pH has to be at a certain level, and if it's just slightly higher or slightly lower, then that can lead to uncomfortable symptoms because it allows growth of certain intestinal flora that might not be desired to be there. I can also check the status of your immune system. I can check your digestive enzymes. So some people struggle with making the right enzymes to digest their food properly, and they get a lot of bloating. So I can check how your pancreas is functioning with its enzymes to help with the breakdown of food. So this is particularly useful if you struggle when you have a fatty meal, because sometimes it might be that you're just not getting enough enzymes to cope with that fat. What else can I check for? I can check for colitis and Crohn's disease. I can check for a tumour marker to see if there's anything nasty in there. I'm looking for blood in the stool. There's so much. I've probably missed some. Oh, leaky gut. Leaky gut is a massive one that I check for. Leaky gut is it has so many effects on the body. It can cause autoimmune diseases at its worst stage. It can cause horrific digestive symptoms and extreme fatigue and tiredness, breakouts, eczema, asthma, horrible stuff leaky gut can cause. And that's where the tight junctions between the intestinal villi, which are like little fingers that line your intestines, the tight junctions are not so tight anymore, go a bit baggy. And then we can get particles and pathogens entering through these tight junctions, which are supposed to be tightly shut, going directly into the bloodstream, and it causes this big immune reaction and often results in an autoimmune condition. So loads that you can do. So the process of doing a stool test is not as difficult as you think. So you generally, the one that I like to do with people to capture, if there is a chance of having parasites, to capture that life cycle of a parasite needs to be taken over 3 days. So you get a little sample pot, and it's a test tube, and inside the test tube is another test tube with a little spoon attached to the lid. So you collect your sample in something like an old yogurt pot, or some people put some tissue on top of a paper plate and can use that. And then you just use this little, looks like an ice cream spoon, use this little spoon, take some of the sample, pop it into the sample pot, lid on tight, pop that inside this other bigger test tube, pop it inside the box, shove it at the back of your fridge. You can't see anything, it's all in a box and it's totally secure and fine. And then you repeat the process over 3 days. And then you just send it directly to the laboratory, and your stool will then work its way by airmail all the way to Germany, and then which is a really fantastic laboratory that I work with specifically for this kind of testing procedure. And then it takes about 3 weeks to get your results back, and then we go from there and we can formulate a plan to work exactly on what the underlying cause of your digestive distress is. So if that interests you, I think the prices for my stool test start at 125, and there's different layers depending on what we need to screen for. It's an investment, but it really is worth doing. I do one routinely on my family every year just to check their health, make sure their microbiome is absolutely top notch. And I really do recommend them because they just reveal so much about you, and it's a really good place to get started from. Okay, hope that answers any questions that I've had recently about stool tests and makes you feel a bit more confident about having one done maybe. Okay, bye bye, have a great day.